I am going to start with community outreach as a way to help increase access to cancer trials, because we know that there's a lot of barriers that prevent access. And in my 25 years of working in this area, I recognize that access could account for as much as half of all disparities in clinical trial enrollment, as well as cancer care. So if you can solve access, you're almost, in some cases halfway there. But lack of access occurs for a variety of reasons. As you know, here in the U.S., we have a very segregated healthcare system, and there are communities that have been historically segregated for political reasons. And there's been a systemic de-investment in those communities, in their housing, in their social determinants of health, but also in their healthcare. Many of the healthcare systems that exist in those communities don't have the resources to offer clinical trials. So that's one example of a barrier. Of course, these communities have, as we just said, greater barriers in the social determinants of health, lower education, for example. So they need ways that we can maximize education to the community by us coming to the community. And problems with transportation, for example. They often have to take, in my community of Philadelphia, 2 and 3 trains and buses to even get to our cancer center from their community. So there's the social determinants of health as well that interfere. So what we've done at the Abramson Cancer Center is developed a more comprehensive community outreach and engagement plan that involves, first of all, partnering with the organizations that serve those communities, such as faith-based organizations, but not limited to the Black churches at all. We also work with community clinics and even some businesses like the Black barber shops and beauty salons, the Philadelphia Public Housing Authority, another partner. And then we help by bringing the messages to the community, understanding first, what do they know about clinical trials, and then meeting them where they are. If the answer is nothing, it gives us an opportunity to educate the community. But if what they say first is actually a myth or misconception, it gives us an opportunity to address that. So education is a big fundamental aspect of this community outreach and engagement, but it's not enough. We also have to overcome those social determinants of health so that individuals can come and see a provider at the Abramson Cancer Center who can then offer not only the care they need, the standard of care, or as an option, a clinical trial. How do we do that? We bring and engage our financial navigators to help individuals who don't have insurance gain access to insurance. We also engage our patient navigators who are able to arrange for their appointments and reminders, explain what's needed of them in terms they can understand. And navigation, as you know, has been proven to be one of the most effective interventions in reducing disparities. So we have patient navigators. Then we also created a partnership with an institution called the Lazarus Foundation, which runs a program called Improving Patient Access to Cancer Clinical Trials. And what that program does is it reimburses patients for travel-related expenses so they can access a cancer research trial. And that includes, everything from gas, tolls, renting a car, a plane ticket, train ticket, you name it, parking. And it includes lodging if individuals have to stay overnight for them and a caregiver. So that's one way we've been able to address transportation and lodging barriers, which are access barriers. We also partner with the American Cancer Society that has programs such as Road to Recovery, in which a volunteer driver drives patients to their appointments, as well as Hope Lodge. We have a Hope Lodge in Philadelphia that provides free housing. There's a patient access foundation that also provides financial support for reducing copays for the visits. So in addition to education and in addition to addressing the social determinants of health, we then work with our PIs to make sure that individuals who we bring to the Abramson Cancer Center, they are aware that not only we have established these programs, but then the last thing I'll mention is we're creating a a clinical trials ambassador program where we actually match those individuals once they get to the Abramson Cancer Center with someone who's either had cancer or has been a caregiver for someone with cancer and has participated in a clinical trial. And that individual provides peer-to-peer education, and they're matched to be of the same culture so that that individual that's being matched as an ambassador can address cultural concerns. And we've completed all their training of the ambassadors last year, and we're waiting to hear about a grant that will allow us to match and study the effectiveness of that peer-to-peer intervention. I think I'll stop there because that was a lot. It's been 10 years of work, and so it adds up to quite a bit of programs. And I tell people that, this is such a complex problem that you're not going to have one solution. You're going to need layers of solution to address the layers of barriers, almost like an onion. You peel back one layer and you find out, there's more barriers to address. And so we've been addressing this ginormous problem, very complex problem, through a series of interventions, which I've just managed to summarize so quickly for you.